Been having a look through some of the findings and the recommendations of your and your team's investigation, and perhaps what was most alarming is that first patient, we call it patient 0, I suppose, was not suspected of having COVID-19 and she didn't have any typical symptoms. That must have thrown off doctors completely at the time when the virus was still very, very new in the country.
Yes, good morning, Michelle, and morning to your viewers. Yeah, you've picked up on an important point there. I would just ask you, if possible, to not use this term patient 0, because actually it's a very stigmatizing term when we think of outbreaks and infectious diseases. But that aside, I think you've picked up on the really important point that this virus was able to spread through the hospital, because the first people that were affected with the infection were not really suspected of having the infection. They were not the typical person that was presenting with COVID at that time. And you'll remember 9th of March and the time around early March was when we were still at the very early stages of the epidemic. We just had a handful of cases in the country. And so what we were seeing was COVID was affecting people who were travelers who had returned from traveling in Europe and elsewhere in the world. And so that was the problem here, was that the virus got transferred from one of those people who had been traveling to another patient who was admitted for completely different reasons. And then it was able to spread quite widely through the hospital on a number of different hospital wards. And to us, it really highlights and illustrates how quickly and easily this virus can spread in a hospital environment. And it stresses how we need to have really strong systems and practices in place to prevent the spread in our health facilities, so that we protect patients and we protect our healthcare workers.
And obviously we know now that those at the forefront of fighting COVID-19, you know, they're kitted out in their PPEs. There's a lot of protective measures that are in place when treating patients for COVID-19. Are we understanding you correctly that when this first patient was brought in, that he or she was being treated without any of those protective measures?
So the important thing to note here is that a lot of the spread of the virus happened on general wards. So it happened on wards where they were not treating COVID patients. There were not known COVID patients. So the personal protective equipment would have been the standard personal protective equipment that's used. And that means a surgical mask. And then it means possibly a plastic apron and gloves if you're handling the patient. So, but what this really highlights to us is that personal protective equipment is just one component of what we call infection prevention and control systems. And so personal protective equipment is really important for protecting healthcare workers. But there are many other components that come into infection prevention and control that are just as important, and we need to strengthen all of those if we're going to prevent this happening again.
So several incredibly alarming findings in that document from you and your team, Dr. Lessells, not least of which that the hospital outbreak and the way it spread to other institutions on the campus, those numbers accounting for 14% of the total cases in the province up to the end of April.
Yeah, and again, that comes back to the earlier point to some extent, that this was happening very early in the epidemic. So,
yeah.
So the cases that were accumulating here in the hospital, in the dialysis unit, as you say, were some of the first cases that were being detected in the province. But the important point here that it highlights is what we're facing now is that these clusters of infection in hospitals, in clinics, in other institutions, prisons, workplaces, that the real risk there is not just the infections in the institution, but that it fuels transmission in the wider community, that it really, what we call, amplifies the transmission. And that's why there's a lot of attention being paid now by the Department of Health and things to really trying to prevent these clusters of infections and try and limit the extent of them so that that contributes to the broader control of the epidemic.
Yeah, and it just highlights yet again, we've been talking for some time now about just how scary it is, the rate at which this virus is able to spread. I mean, staff infections at the hospital, there were 80 cases, and there were even a few cases of staff testing positive, even though they weren't directly involved in patient care.
Exactly. But just to put that figure a little bit in context, Michelle, so 80 does sound alarming, and it's a lot of people getting infected. What's important, though, was that the hospital did systematic screening and testing of pretty much all their staff, both the people involved in direct patient care and the support staff. And that was almost 2,000 people. And so the 80 represents about 5% of all their staff. Now, that is still a big number, as you say. But just to put it in context, many of the places worst hit by this epidemic in Europe and things have reported that at any one time, 10 or 20% of their healthcare workers are out of work because of infection or exposure to this virus. So it's something that we're seeing around the world, this problem of the virus spreading in health facilities.
Yeah. Dr. Lessells?
And like you said, this issue of it not just being the nurses, but also other staff, really highlights to us that all the simple measures like the physical distancing, the hand hygiene, are important at all times, wherever you're working in a health facility, outside the health facility, on your way to work, on your way home from work. All these things are important to prevent the spread of the virus.
I want to just ask you this question as we wrap up our interview. We've run out of time, unfortunately. But do you get a sense in your investigations that the hospital got around to what was unfolding on its campus in good time? Or did it take a bit too long for it to come to grips with what was unfolding, with the rate of infection that was unfolding at St Augustine's? And perhaps you can just give us a line as well on advice to other hospitals on how to deal with COVID-19.
Yeah, so in our full report, we talk about there being a couple of points at which the hospital could possibly have acted differently, and that might have limited to some extent the extent of the outbreak. But these things are always looking in retrospect, and they're not looking in real time as events are unfolding. And I think, as you've seen, we're learning every day, and we're seeing more and more of these outbreaks. One of the critical things that we learned that we want everyone to take forward is really that you have to jump on the first case that you find in a healthcare facility. And whether that's a staff member or a patient in the health facility, you have to really be quite aggressive with investigating that case and understanding, could that case have been acquired, could that infection have been acquired in the hospital? Or is there evidence it was acquired in the community, at home or in the community? And really jump on that and then see, have there been other people exposed to the infection in the healthcare facility? And that's something that we're seeing now. And I saw on your headlines just now, there's every day now you're reporting a different health facility that's picking up cases and clusters of cases. And I think that we're getting used now to kind of jumping on the first case. Because by the time you find that first case, there will often be many other cases that are already infected. So if you're not aggressive, then it can just very quickly get out of control.
Yeah, absolutely. I suppose the good news is that we are now starting to come to grips with just how stealthy COVID-19 is. Dr. Richard Lessells, thank you so much for your time on the AM report this morning. Dr. Lessells leading that team of KZN. who looked into just exactly what unfolded during that outbreak at St Augustine's Hospital in that province. Just some other tips, I suppose, to keep in mind when dealing with COVID-19, and this is for everyone, not just for hospitals, but hand washing, again, is so incredibly important. Hand washing all the time, physical distancing, and wearing your mask wherever you go.